Welcome to Glass Half Full with Leslie Krongold. She shares her stories, experiences, and knowledge of living and coping with a chronic health condition. Learn about tools and resources and hear inspirational interviews that help you to live a life filled with quality and dignity. With 2 decades of support group leadership, Leslie's ready to help you make lemonade out of life's lemons. Are you ready?
Hello, and welcome to the podcast. I've been toying with this topic of vocal problems for a while, but after being sick for 3 weeks and not being able to communicate verbally for much of that time, I realized it was time to tackle the topic. I have a couple of guests I've interviewed, no experts, no speech therapists, just people who have, shall we say, challenges using their voice to communicate. A lot of people experience this at some point in their lives. For example, laryngitis. There is acute and chronic laryngitis. The only factoid I could find was for chronic laryngitis, which stated that 21% of the population may develop chronic laryngitis. That's really surprising. So I'll assume that a much larger percentage of people will experience acute laryngitis. I certainly have. Laryngitis is an inflammation of your larynx or voice box. It happens from overuse, irritation, or infection. Your vocal cords are within your voice box and are vital to your breathing, swallowing, and talking. All I know is that when I have some type of respiratory condition, I have difficulty speaking because I cough and choke. And if I'm able to squeak out a few words, they're really hard to hear and understand. I also suppose my difficulty is more related to having a muscle disease which affects my breathing, swallowing, and talking. And by the way, Chiquita is making noise in the background. She doesn't like when I talk about problems of any kind, so just ignore her. She'll stop after a while. Thankfully, I've recovered, but I know my voice is weakened. And I noticed this if I listen to my earlier podcast episodes from 3 years ago.
In the past 3 weeks, I curtailed much of my interaction with humans except for my spouse. I found some relief using a couple of technology tools. One is using the text-to-speech feature in Microsoft Word. When I had something substantive to communicate, I sat at my computer, composed a lengthy message, and had Jessica sit down and listen to one of 4 assistants communicate for me. You've been listening to Samantha.
But perhaps you'd rather listen to Victoria. Victoria speaks a little slower, though there is a pacing feature available for each of the voices.
To mix things up, no one says I can't have Alex speak for me.
Or Fred. Fred likes to speak for me too, but sometimes I just want to shut him up. Shut up, Fred. Okay.
Sitting at my computer can get to be a drag, so there is a text-to-speech feature in Notes on my iPhone.
This can come in handy, but be careful about spell check because it could make communication efforts even more difficult.
So, that's how I got around for 3 weeks. How do others do it? Vocal problems exist for others with neuromuscular disease, Parkinson's disease, stroke, and a number of other conditions you've likely never heard of. My friend Christine, who is a retired nurse and writer, shares her story of getting an accurate diagnosis for her vocal problems. When did you notice something was unusual with your voice? Was it a a dramatic change? Did it happen gradually, or did someone bring it to your attention?
I think maybe 8 to 10 years ago, I noticed that my voice was different, and it was very gradual. No one else brought it to my attention, but when I described it to my primary care physician, she immediately said she knew what I was talking about. So it was clear to her that something was going on.
And was she the one who diagnosed you?
No, she referred me to an ear, nose, and throat doctor. I think now they call them head and neck surgeons, but that was the first step of a pretty long process trying to get diagnosed.
Oh, really? So what did the ear, nose, and throat doctor think?
Well, the first one thought that it was probably either acid reflux or allergies, and he prescribed a neti pot, a sinus rinse device, and medications for excess acid, and that didn't really make a big difference at all. So my primary care physician moved on, and I had a different one, and she sent me to another ENT doctor who sent me to a speech therapist. He said I had some. Later, I found out that he called it dysphonia, but he didn't tell me that. He just said, I'm going to send you to a speech therapist who can help you correct your speaking. And so she saw me for about 10 or 12 sessions, and she never mentioned spasmodic dysphonia, and I didn't see a lot of improvement. I hung in there because I thought maybe it was helping, but it didn't seem to really. Well, she just had me breathe more effectively from my abdomen and make sure that I was really projecting my voice and leaning forward, and she had me do different sound exercises that she said might help. And I didn't notice any change really. And then one day I was talking to a friend, and she is in Ohio, and she told me that this NPR radio personality, Diane Rehm, sounded a lot like me, and that she had this condition. So, I mean, she couldn't remember the name of it, but that she had talked a lot about having some voice condition. So I went into sleuthing mode, and I eventually found Diane Rehm, and that she had spasmodic dysphonia, and there is a national association that deals with spasmodic dysphonia at dysphonia.org, and I went there and I listened to they have sample voices there on the website, and I was just so stunned because it was like listening to myself. So I sought out on the website, because this condition only affects they estimate about 50,000 people in this country. So a lot of doctors haven't really run into it in their practices. So on their website, they list doctors who have some knowledge of the condition. So that's how I got finally an official diagnosis, and I started the treatments with Botox, which help with the spasms that occur with this condition. It's a neurological thing that causes spasms in the muscles of the larynx that cause the voice to sound quite strained. And the Botox actually relaxes and paralyzes those muscles and doesn't really, for me, work too well, but it's a small improvement. And the downside with Botox is that you have a period where your voice is very soft and kind of breathy. Mm-hmm. And I just had a treatment about 2 weeks ago, so I'm in that phase right now.
How long does it last? How frequently do you get the shots?
Well, this condition is not predictable. Everyone seems to have a different reaction. They don't have a specific dosage that they recommend for everyone, so they start you out usually with a very small dose, and then depending on how that works, they increase it. And people have quite different reactions. Some people it only lasts for a month or two. Other people, it lasts 6 months. For me, it seems like it's 2 to 3 months that it lasts. Mm-hmm. And it's, for me, not a perfect treatment. My current doctor, who has a lot of experience with this, told me that I have both spasmodic dysphonia and a vocal tremor, and the Botox only helps the spasmodic dysphonia, which causes breaks in the voice, but so the Botox helps the breaks, but it doesn't help the tremor. So it's only partially effective for me.
What, if anything, helps the tremor?
Nothing that I've found.
And so you went to a support group. Can you tell me about that? Was it helpful, the experience? Do you continue to go?
Yes, I go whenever I can. I think it's because this condition is not very well known. People who are diagnosed are really eager to talk to others who have it and find out how they've coped with it and what has helped and what hasn't, and which doctors have been helpful and which have not. So I found it to be really good. We share our experience with whatever treatment protocol, the frequency and the amount of Botox, and we talk about tools that we can use to minimize the impact of the condition. So yeah, I can't think of anything negative about going. It's been really helpful for me.
What are some of the tools that you mentioned?
Well, for example, the Center for Independent Living in Berkeley and Alameda, you can get a special telephone that helps you be heard better. I haven't tried it yet, so I can't speak to exactly what it does, but they've been working on the technology for not just this condition, but for many conditions related to voice and being able to be heard on the phone. Mm-hmm. And so we had a speaker come who talked about that. Sometimes we do relaxation sessions, and we've had speech therapists come who recommend certain practices when you're trying to project your voice more effectively. So that kind of thing.
Mm-hmm. That's great. Does anybody know why it happens all of a sudden? Because, you spent, most of your life without it until would you say, about 8 years ago?
Yeah, yeah. They don't know what causes it. Some people actually get it as teenagers. Others, it more commonly develops in middle age and older, middle age and older. They don't really know. There is a fair amount of research, and the National Association I mentioned is trying to fund some of that research. I participated in a program through UCSF where they're trying to look at what the causes are and, determine how to address the problem more effectively.
And you come from a large family. None of your siblings have this condition?
No.
Okay.
I don't know anyone else in my family.
And you had told me some famous people. Who were the famous people you mentioned?
Well, Diane Rehm is one of them. Scott Adams, the cartoonist, is one.
Oh, okay.
Susan Collins, the senator from Maine. If you listen to her, you can hear the breaks and the hesitation in her voice. John F. Kennedy Jr., I guess he's the son of Robert Kennedy. He has it. Yeah.
Well,
those are the ones
that's pretty good for having such a rare condition to have all these famous people.
Yeah.
My disease, there's no one famous, so.
Oh, no, really?
Yeah.
Oh, that's funny. I'm sure there are famous people. They just, I don't know, maybe because they're not using their voices, they can hide out more effectively.
Recently, I read a blog post by a neurologist who had to leave her medical practice due to her advanced Parkinson's disease. One of her symptoms, hypophonia, affects her voice, making it soft and difficult to hear. She's been able to resolve this with an increase in her medication of levodopa and speech therapy. Earlier this year, I was at a seminar given by our local Muscular Dystrophy Association office in San Francisco. I had the opportunity to meet a young woman with SMA, spinal muscle atrophy, named Hannah Eid. Hannah was one of the presenters and discussed how she opened an ABLE account. An ABLE account is a tax-advantaged savings account for individuals with disabilities and their families, and these were created as a result of the passage of the Stephen Beck Jr. Achieving a Better Life Experience Act of 2014. And ABLE, A-B-L-E, is the acronym. I wasn't so interested in the ABLE account, but what made Hannah's presentation so memorable is that she used computer technology to deliver it. Here's a brief interview with Hannah. At what age were you unable to use your voice?
I have had a trachea ventilator since I was 6 months old, so I've never been able to speak vocally ever. I've been using some sort of communication device ever since I was 3 years old.
And how old are you now?
I'm 22.
And so, can you tell me about the technology that you use now to help you communicate?
I use a communication device called a Toby. I use a switch with my right hand, and it scans around the screen, and I select the button I want.
You select the button with your finger?
Yes.
And is this the same technology you used when you were a child, or has it changed?
I've been using a Toby device since January of 2018, and I absolutely love it. It's also a computer, and that's really cool because I don't have to use laptop anymore. Before I used a device called Dynavox, and I could use any PC computer with a remote control code and access it, and it was great, but having a communication device and a computer in one is so convenient. I also don't feel limited vocabulary-wise because the Toby has great word prediction, whereas with the Dynavox I had pre-programmed words, and the spelling prediction wasn't great. I do have set up pre-programmed phrases on my Toby so I can talk quickly, otherwise I type it out, which takes more time, but it's worth it. As you can see, I like to talk.
Well, that's wonderful that the technology has improved and it's just helped you create, be able to communicate more clearly and naturally.
Absolutely.
So, I didn't have any more questions. Would you like to add anything?
I do freelance web development, so if you know anyone who needs a website, I'm your gal.
Okay, so maybe you can send me a link to your website through Facebook, and I can include that.
Of course. Thank you so much for having me, Leslie.
You're welcome. I appreciate it, Hannah, and I will see you on Facebook.
Have a nice day.
Thank you. You too. Bye-bye. Although we each have different conditions, we share a similar symptom, albeit to varying degrees. The big takeaway for me is that we can learn from each other. We can learn about coping mechanisms, assistive technologies, and other resources, tools, or hacks. Thank you to Christine, Hannah, and that doctor with Parkinson's for sharing your stories.
Thank you for listening to Glass Half Full. Leslie invites you to leave a rating and review on iTunes. This helps spread the word to others dealing with chronic health issues. For show notes, updates, and more, visit the website glasshalffull.online. Glasshalffull.online.